All right.
Yeah, I was like.
All right. Okay, so we're just going to take some deep breaths. So I want y'all today write a negative thought that y'all heard or something that bad happened to you. Just write it on a white piece of paper. Or something that's like you're just not quite sure about. Maybe you're at a crossroads in life. Maybe I don't know. Can't think of one. If you're having trouble, you're doing pretty good. You're the jolly mama. Wow. You can stand up. You can stand up and do the meeting. I could write a shit list. All right, let me know when you're ready. All right.
Really?
You can fold in half whenever you're ready. No, you can keep it.
This one. That was nice.
Oh. I'm a nurse. All right, so everyone just rip it up. Just violently rip it up, throw it up. Yep, good.
That's the meeting right there.
That's the meeting. No, you're welcome. All right, so we're gonna go back to a good deep breathing. All right. Oh, you want? She got a little bit. Don't hold on.
Right.
Alright, we're gonna blow out those negative thoughts. Have that sound wash over us. This is all about just being present in the moment. It's not about just being completely still or silent. If that negative thought creeps back in your mind, we're just gonna maybe let it sit there. Just kind of passively exit our mind. We'll kind of feel that sound. Feel that breathing. That warm air is in your body. That energy is feeling our toes. Let me sign on the iPad. And get some signs in the back. All right, so meeting business is it's a new chapter, so I really just created it for everyone. I'll just take it, run with it. I mean, we can have some board members or not, just kind of. I'm going to send a poll after the meeting though to kind of let y'all just kind of of get your feedback. We have memberships, that's kind of just a little bit of money to kind of cover some of the meeting costs, some of the self-care. I really got into holistic nursing for that aspect. I'm a certified registered critical care registered nurse. And I like that they send out a lot of things about burnout and pressure injury and resilience and all these things, but it seems like I hear about all these stats, I hear about all this research, but there's no solution. Or I hear about, oh, it would help if we have more self-care cards or a garden to go to, but if you're slammed and you're tripled all the time, everyone's there, who's going to leave you to go to that garden? So that's kind of why I did it, because this is the only organization where, of our 5 principles, one of them is self-care. I have to be cared for before I help somebody else. I have to be a full battery before I can give that energy. So that's why I did it, and I hope the emphasis that is created, the environment that's created first and foremost. So that's what I want. So, I'm just going to kind of introduce holistic nursing for the presentation first. I'm a child to kind of introduce yourself, kind of who you are, what you do, maybe a fun fact. So, my name's Matthew. Like I said, I'm an ICU nurse. I do I'm an ECMO specialist, and I feel like my whole life was kind of my mother. I learned a lot of nursing from her. I try to go back to the basics about what she taught me. I actually never thought I would ever be a nurse, so it just kind of hit me one day. So.
My name is Maggie Sharenko. I'm the program director at Atlanta School of Massage. I happened to get an email from Matthew last week or the week before, and I was like, wow, I've never heard of this organization. This is kind of right up my alley. I've been a massage therapist for 15 years. I'm also a certified personal trainer. In addition to being the director, I also teach both programs at the school, and we, as massage therapists, also encounter burnout. The average career expectancy for a massage therapist is about 7 years. So we try to teach our students their own self-care, and the analogy I learned in school is, you can't give to others if you don't give to yourself first. You can't pull from an empty well. So just trying to pass that along to my students. And also we have a partnership with Inaugural University where we conduct research studies with the benefits of massage, and just seeing that side of it, and that there's a need for more of it within the massage community, to do more research, to learn how massage can benefit, and are there standardized protocols? Are there ways to incorporate self-care for continued benefits to clients and different communities of healthcare providers? So I'm excited to be here.
Hey everyone, my name is Lauren. I also go by Nurse Elrose, and bring myself as this is a new part of
You must be the influencer.
Sort of.
Okay, then you're going to be our media outreach, okay? That's where my struggle, so that's going to be you.
So I went to nursing school at Georgia State University, graduated in 2014. Did 5 years of nursing at Grady as a neuroscience nurse, stroke nurse. Yep, burnout. And I also did some travel nursing in Augusta as well as my hometown in Savannah, Georgia. I was taking care of my grandmother as a primary caregiver for her with Alzheimer's, which is how I got into advocacy for Alzheimer's Association. So I am ambassador for the Congressional 5th District for Representative John Lewis. Work hard to help with health policy for Alzheimer's, and I'm trying to get them to incorporate a lot more holistic nursing into that. For my personal life, I am a super mom of a 6-year-old. The reason I'm not currently working at Grady anymore, I had a seizure last September. Yep. Seizure last September, and I am definitely a life advocate for that. Been away from the inpatient nursing area since then. It's very difficult to be away from the bedside, especially as a stroke and neuroscience nurse. But I had to realize, stress, sleep, everything after attack, and a seizure was not the best for me. So I am currently a full-time student at Tennessee State University studying holistic nursing. My goal is to be a holistic nurse practitioner. I'm not going to talk about my negative thought, but it has something to do with school. But I thank you for that enlightening moment because I realized what I need to do and how I need to meet the right people in order to kind of meet those next goals that I have. So I don't know what journey I'm on yet, but that's that. And then right now I'm a nursing supervisor for a home care agency. So I do that part-time. Just got my work clearance and just got my driver's license back. So thank you. That's me in a nutshell.
Well, I'm Melanie Womack. I'm actually a mental wellness nurse. I started coining myself that because I got disgruntled with mental health and mental illness. I rotate through here through labor and delivery, but I've been doing more psych. I do a host of things. I don't necessarily know where to start, but I'm working at Atlanta Detox Center now, where I'm actually able to be a mental wellness nurse and where I'm actually hosting a group in addition to being a nurse. And then in the community, I'm a performance poet, author, and women's empowerment coach. But it's one of those things where I'm getting clients now where I'm getting to work in actual mental wellness. So I'm seeking a space to actually begin to meet with my clients. Eventually, I'm going between the holistic certificate or the nursing coach certification.
Go for it.
Yeah. So that's what I do. And I was so excited to get an invite because I was like, oh my gosh, there's actually other people that are interested in the state of Georgia because most states are, not Cincinnati, but California stuff, they're onto it. And I could not find anybody here that is an RN that was actually interested in expanding and actually emphasizing the mental wellness aspect or holistic nursing.
Well, I'm among some amazing women in here.
Okay, thank you.
Or man, sorry. You're holding one. That's amazing. This is awesome. And this is so great, Matthew, that you did this. So I am also very glad to know that we're not alone in Atlanta, in Georgia. So I'm a nurse, and I work at Wellstar at Atlanta Medical Center. And I started off in the ER and then created an integrative health department. So it's been, it took a year to create it, and now I've been in the position of integrative health manager for 2 years. We've created an integrative health employee renewal center. So we're working, the strategic plan is to work on our employees first. And then once we have the engagement of our staff, then we're going to move towards patients. But first I realized that engagement of ourselves and the taking care of ourselves, like we talked about, is so important. We can't get any further patient care until we do that part. So we've been working on that aspect, and this is actually the next step. So I'm so glad you beat me to it.
Well, no,
it's meant to be.
Something happened. Yeah, you're right.
It was so perfect.
Yeah.
And because we have so many things on our plate, and this is something that's so important, and we're glad that you joined the team. And that was perfect timing for you to meet Charlene all through, because I meant to email her today too, and I didn't. And then that was just like, wait, we need to get in. Will you let us in? Whoa. That was so perfect that all happened. So this is just really cool timing, and I'm really glad to be among all of y'all. This is really cool.
Hi, I'm Julia Spinola. I'm a doctor of nursing practice and a board-certified family nurse practitioner, and also a Reiki master. I like to learn a lot, apparently. And I was a nursing professor for years, and 4 years ago I was diagnosed with breast cancer, so I used Western medicine, but also Eastern medicine to help me heal, and that's what really got me into integrative health. I'm fine now, health-wise, and so I went back to work and just started at Wellstar with Kat as their lead educator for the Integrative Health Center. So that's why I'm here to bring in the holistic side of nursing to our employees and eventually, again, to the bedside. So thank you for holding this meeting. It's great.
Are you the next day?
My story is not like any of you guys.
I'm sure it's
Doesn't matter.
It's a journey.
Doesn't matter.
You know what I heard today? They said, remember, someone else knows something you don't.
Correct.
Oh, yeah.
So remember, you know something that no one else in this room does.
Looking forward to learning. So I'm Kristen. I am a nurse. I was a neuro nurse at Wellstar Cobb.
Then I went to the ER. Now I'm traveling. I got into holistic health because I have had and still do have trouble conceiving. So my research of different holistic methods to help with conception brought me to holistic health. And the more research I did, when I found out about the national organization, then just so happened to get on Eventbrite and type in holistic and voila. And here I am.
Best for last.
So my name is Alicia Caraballo. I've been a nurse for 19 years now, and in 2004 I had a health crisis with my youngest child. So that's kind of what led me to look outside of medicine, because I kind of knew I've been in way too long. I know I had been in the treatment for 3 years and things weren't looking good. So that's what kind of made me decide, okay, it's been 3 years. You know, maybe I need to take matters into my own hands now. So I started researching and learning, and I came across the whole holistic world. It's been 5 years now. I still work in acute care, PRN, but now what I do is I teach people, I bring awareness and education on detoxification of the body. I deal a lot with aromatherapy. I'm involved in the essential oil world through doTERRA with the integrative health clinics. And I'm currently in teacher training to be a yoga instructor.
Wonderful. Great. All right. Anyone have any questions, comments, concerns? Anyone want to ask?
I was already a member before, but I needed to renew.
Okay. So the membership I'm talking about is just for this chapter. Unfortunately, it helps us keep us, do things. My idea is that we have like self-care days where we just come in, like someone comes in and does yoga or guides meditation. We bring skills, we bring friends, we bring networking. That's what it's for. Self-care, like I said, first and foremost, where we have meet and greets. We have things like this, education. We'll have, hopefully, long term, I would love to do community outreach. I feel like I'm a pet therapist here. So I feel like that has renewed me. I only do it if it is renewing, first and foremost to me, help my patients. So when I get, negative Nelly over there complain, I go over. Okay. So that renews me. If that's something y'all would like, partnering with a clinic to do Reiki, to do healing, to do whatever therapy that you do, I would love that long term. But like I said, I've just created this. I've set it up for y'all to run with it. So that's my idea. Did that answer your question? Okay. So the membership that you have through AHN is just for the national organization.
Okay.
So yeah.
So, well, I had a question, comment, I think. So I joined with the intention of coming, to kind of see what it was about in addition to. But my intended goal is to eventually become a nurse.
Yes.
So I have to get my bachelor's in massage. That's my next goal. So, but I'm excited to be around all of you with your wealth of information in that regard and share what I know about massage.
You don't have to be a nurse to join. Anyone in the holistic
Excellent.
World, or consumers, and even if you're like, oh, I love essential oils, you can come here to this meeting, because again, it's about advocacy, it's about leaking up, it's about spreading that, it's about research. So let me see if I can get this thing started somewhere. It's the button. Perfect. Okay. So perfect. Okay. So I had a video, I can't get it started, so just briefly discuss what attracted you to holistic medicine, or holistic, or whatever it is. So for me, I love that it's in my hands. I similarly went through seizures 4th grade, and so I was seizure free for 6 years, and I took Flexeril for my back. Took it before, it didn't help. I figured I was doubled over. I did literally everything, massage, I did the roll, I did everything, essential oils, all that stuff. And I was like, I had to give in. I don't want to take the pill. And like a man, I'm not going to the physician. So I took Flexeril, and I actually was feeling all wonky, had a seizure, long story short. I went to my neurologist and I said, well, I've had 3 physicians that I've seen with this that wanted to give me something else that would actually induce a seizure. So what do I do to stay seizure free? He said, well, actually, I'm just going to up your medicines. I'm going to add some more medicines so you won't have a seizure. So, well, that doesn't really, he's like, I don't think it's the Flexeril. Okay, well, long story short, so that's kind of their mindset. So let's add more fuel to the fire. So that's why what attracted me. I love the patient involvement.
So, well, your email, I was intrigued. I didn't know this organization existed. But I got into massage therapy 15 years ago. I was 19 when I went to massage school. I knew I wanted to do massage. I liked using nonverbal communication to help people feel better. More kinesiology. I was an athlete for a long period of time and developed injuries and things like that. And I was also fortunate that my mother introduced me to chiropractic at a young age in my swimming career. And since then, I've found an amazing community with massage. A lot of people with similar stories where they've just been given medicines and it didn't feel like that was what they needed and they wanted to do more searching. And then I happened to be at the right place at the right time and became director of the school that I graduated from. And ever since then, I've been exposed to so many things that standard massage therapists would never come in contact with, so I'm looking forward to sharing that with other massage therapists because we also suffer from it consistently. So I just massage, ironically, does not relax me as much as other things like yoga and meditation. But I know it depends on what works for the person. Whatever your holistic lifestyle is, and encouraging students that there's a balance between the two. So Eastern and Western can come together. There's a time and place for everything. And I'm just grateful to have been given, to be put in the right place at the right time and have the platform to meet amazing people and share cases.
So I briefly touched on it. Another thing is my parents, they met in Saudi Arabia. My dad was an Air Force logistic guy. My mom was an international travel nurse. So my perspective from young to now has always been different than my friends. My mom used to make us like homemade penicillin instead of antibiotic, like stuff like that. So, and she was a British trained midwife as well as a nurse too. So I think a lot of my background comes from there. And then when I got to college, it was like, oh, you do what you want, So I wasn't necessarily doing the same things, but I still had my same routine. Then I was diagnosed with a tumor in 2012, really rare tumor, and they just kept trying to throw all these pain medications. I was like, for what? And I have a really high pain tolerance, so I didn't want all that stuff. So I did like hot water and ginger, and I was fine. And they were like, you have a tumor. What's going on? And you're fine. I'm like, yeah, just remove it and I'll be fine. So I did a lot of holistic stuff. I wasn't on pain meds. And then with the epilepsy, I kept telling my doctors, I will not have epilepsy for a lifetime. Like, this is just temporary, I think y'all are just making this up, like all types of stuff. And I know I was having seizures, but I knew that was the most like extreme of things. So this last time around, I know it was, emotional flashbacks from a patient assault, grieving, stuff like that. So I knew like there's stress. It's not just something just going on. So wanted to educate people on that and having the proper conversations with people. It's not to say I don't believe in acute medication, especially as a stroke nurse. Like I saw how TPA worked or stuff like that. So I'm not going to say like I completely abandoned it, but I don't feel like we give enough education and just communication to people about it. So with my journey with epilepsy and everything like that, I knew something was going on, and I let my doctors know consistently, like, I'm in healthcare, but I'm also a patient, so I'm going to be involved. And I think a lot of people just don't know how to have those conversations. So me trying to educate people on how to have those conversations, as well as showing my journey, I think has helped myself. And then I know for sure that that's why I got off 7+ medications. Because I resorted to a blood type meal plan, a lot of herbal therapy, aromatherapy, acupuncture, pelvic PT, massage, chiropractor, hot laser, deep tissue massage. All of those things like help me together, and I wish more people had it too. So that's pretty much why this is like my love. And like I said, I'm studying it. It's hard, but hey, it's all in it. Yeah.
Well, I got really, really just upset with where I see mental health at. It's a challenge. I went from one place to the next, and it's just the same thing. Where my own healing began was when I got a life coach in about 2012, 2013, and there was an exposure to that. She helped me. It took me off onto this career thing. I became a nurse in 2013. Then in 2017, I decided to go save my life, and I went through a spiritual development program, which was 2 years, just graduated. And they exposed me to a host of things. And so for me, where I fit in with mental wellness and holistic nursing is where if I can support you in your mind frame and give you an opportunity to reframe, then maybe you can have a different experience in your life, and most importantly, own it, so that you can begin to go do the things that you do. But really, I just got really frustrated. At first, I was like, there's something wrong with me when it comes to the mental health aspect. But they are failing people. There are success stories, but now I'm seeing people use the term wellness, and it's still, you're not changing the modality. So I'm like, it has to be something different. So I said, why not me begin to be a change agent and just change my name completely? So instead of saying mental illness nurse, mental wellness nurse or mental health nurse, I said, I'm going to support people, specifically women. And I find that men are being attracted to me as well. And identifying what works well for them. So that is my story. So it's just more out of disgruntled and like, what is happening? Yeah. So, and so that's what's brought me here, and I'm just totally excited because again, we are in the South, and there's a certain mind frame here, and to begin to do the work that I'm seeing, Eastern, Western, what have you, but it just can all be inclusive, and to be able to integrate everything. And I'm just excited because I get to hear just the different modalities. So excited.
So hard. I want to ask y'all questions. Talk more. Tell me more.
Like I said, I'm trying to plan meet and greets where it's literally just like a coffee social or something. So that's the thing.
Yeah, we just hear more about, because I think it's fun that we're all very passionate.
Y'all have good stories.
Yeah.
I'm so excited.
Oh my gosh, yes, it's great. So I, as an ER nurse, same thing, burnout, realized that I was a Band-Aid, and we weren't really doing anything for patients. I mean, traumatic things, life-saving events, like, the ER nurse, trauma nurse, amazing things. But also there was a lot of things we weren't doing right. So I started learning Reiki, and then also started learning holistic modalities and using that with my care with patients, and realized a lot of my patients didn't need pain medicine, or they didn't need as much pain medicine, that they were, talking about the stress level. CDC says that stress level is 80% of illnesses, and we're not doing a thing about it. Then, all of our patients are coming in mostly with stress. So I started asking my patients, what's going on? We did, $20,000 workup for abdominal pain, and then they were like, well, this car accident and my whole family died last week. Well, that's why you're having abdominal pain, because that happened. So those were my big wake up calls, and so I got to the point like you did. It was like, either I've got to quit and do something else, or I'm gonna try to start this.
Yeah.
And so that kind of the same story as you have. I got to that point, and I was like, well, I got an award, and I realized I couldn't quit at that day. I was going to quit. I was going to quit that morning, and my boss was like, what are you doing this afternoon? I was like, sitting in triage, and he was like, come to this event. And I was like, just stop. And I was like, don't talk. And I was like, well, I can't quit now. And I was like, well, at least I'm going to write a proposal and say, here's my 6-page long proposal with why we need integrative help. Here are the research behind it. And then this is why we need it. And I was like, they say no, then I can quit. And they said yes.
Thank you. Well, I find, I said I was going to quit. And then I said, that's what they want me to do. So I'm going to stay here and permeate the system.
Yep.
Because that's what these people in these beds need.
Yes.
So.
And you can't do it outside, you have to do it then.
No,
Yeah.
no, because the people who go and do all the whatever, all the cryo freeze, they get it. I need to change the people who haven't seen it and been
Yes.
exposed.
We all have to combine together.
Propaganda.
It's hard.
Yeah, it's hard.
Yeah.
I broke. Sorry.
There you go.
Okay. So, as I said, I was a breast cancer survivor. So when I was going through, had months of chemotherapy. So when I was coming out of it, and it's funny because my husband's an oncologist. I had very bad chemo brain, which means I was very foggy. I wasn't cognizant. I'm usually very, type A, I know my shit, all that stuff. So I would just forget stuff, and I'd be walking around and forget where or go driving and forget where I was going. And my husband's like, well, this might be your new normal. And I'm like, no, this is not my new normal. So I've always been a spiritual person. And I went to a group meditation, and during that part, they were doing pranic energy, which is a form of energy healing modality. There's several. And after one treatment, 15-minute treatment, it's like the light bulb came on. And I said, holy crap, I gotta learn how to do this. So I started studying the different energy modalities, and Reiki really resonated with me. So for almost intensively, 40 hours, I did it like a full-time job. I studied Reiki for, months, almost close to a year, and became a Reiki master because I believed the work and I continued to heal. So I opened up my own practice, Reiki practice, so I combine my medical knowledge with my energy work. And really, I do intuitive coaching with my clients too, and I do that as my side hustle now since I have a job here. But I was able to, like Kat said, I could pick out anybody can tell me what's going on physically because that's what I was getting. I was getting all these people coming in. I've had all these tests, and they can't find anything, but I'm having this, and I'm like, I believe you. I believe you're having this, and then energetically, and then I started seeing people get better. And I'm like, this has some validity. So my goal is to infuse the energy medicine into the integrative health, into the hospitals, so we can start providing Reiki and other energy modalities to help patients heal.
I need a job last week.
All right.
I was about to give up grass for last week.
Write down, slip a note. You can feel distance healing.
Yeah. I guess I'm kind of where you guys were. At a point where I'm like, it's nothing really for me. There has to be something else out there.
You were called. It's a call.
Yeah.
You're called. There's something.
So, now I'm really looking into other options, holistic options. More recently, my mindset is more so on like IV hydration. There's still Western medicine, but it's not. And
You can do it being a nurse entrepreneur. So
Right.
you can kind of guide your own business, and then you're the boss, and then you hire a physician.
Right. Which
So remember
that's
that.
where I am now.
Make your money.
That's where I am now. But yeah, just from the research that I've done, just learning about like all the different herbs and supplements and all these things out there that have helped me. Like, wow, I can really, help others, teach others, let everybody know, like, okay, you don't have to take this particular pill that they give you. You can take something else. You can do something else to help you. So that's kind of where I am now. That's what. And by the way, she invited me here.
Oh, great. Oh, so she
said-
let her. Reach one, teach one.
She was like, yeah, I'm going to this. I'm going to go with you.
Great. Yeah. You're all right.
So my story, ever since I can remember, I wanted to be a nurse, and mainly because I wanted to help people. That was my thing. I just want to help. And I went into nursing, thinking I'm going to help people, and I did the best I could as a nurse. I knew what to do in my own way to help. And when I went through that crisis with my son, that's when I started to do things different for us at home, changing things up and learning new things. So then when I would come to work, I would kind of feel that guilt, like I don't think I'm really helping anybody here. So I went through that. What do I do? Do I just walk out, or like what do I do? But I kind of felt like everything happens for a reason, and if my biggest wish was to be a nurse and it was granted,
then it was meant for me to be there, to learn that side, and then learn the other, and then help others through that.
Yeah, that NCLEX is like St. Peter's Gate. I mean, you have to make it- so then we're here for a reason. So, holistic nurse misconceptions. I'm sure y'all probably already heard these. Oh, you're a holistic nurse, and then it just pauses there. It's kind of sometimes I feel like it's a little big. I went to go get my tarot card reading in. And that's great, it's supportive, but there's more to that. There's research. So do you still give medications? Yes, we can. We can. We went to, we got our in-place, we got an education for that. We know about education, or medication, we can educate. So, you don't work in a hospital? We can work everywhere, clinics, home health nursing, research, you name it, the list goes on. Every setting, holistic nursing is a theory, is a concept, it's not just a clinic. So that's not proven, no. It is very difficult, and I'll tell you later in this PowerPoint why it's very hard to research holistic, modalities, because sometimes it's a feeling. We can't quantify feelings. And as holistic nurses, sometimes we don't want to quantify someone's feeling because it gets reduced. So that's why. And is it especially certainly is the American Holistic Nurse Association and the American Nurses Association have declared a specialty. We have our own scope and standards of practice that's on its second edition. We have position statements on certain things, on complementary and alternative modalities. As you can see, 80% have been practicing for over 10 years. 75% have an annual income over $70,000, which is probably where most nurses practices. If I'm not, if I could just give kind of a rough estimate of what most nurses are. And 90% have a bachelor's or higher, which is meaning that 80/20 nurse, I'm talking about where they're talking about DMPs and bachelors and whatnot. So that's from the ANA website, actually. So the roots of nursing, the king holistic nurse, again, goes to Florence Nightingale. You know about her, coined the Lady with the Lamp for helping soldiers with compassion. She is, again, the mother of nursing. And she formalized nursing as an art and science. Now, she isn't the first nurse. Nursing has been around before, but she formalized it as an art and a science, so with her notes on nursing. So I love this so much, this quote so much, just resonated with me in nursing school, along with a lot of her others. But it says, and what nursing has to do is, in either case, is to put the patient in the best condition for nature to act upon it. So we do nothing more, we do nothing less. And I'm reading her notes on nursing right now. She's a hard ass. I would not have asked her. Oh my gosh, she throws a lot of shade in notes on nursing. You read it? It's kind of funny. But at the same time, we are a profession. We have to be guided by both research and the utmost standard. So, we have to be guided by that as well. So, notes on nursing. She had 13 main points, bullet points or whatever you can say. So, ventilation and warming, health of the home, petting management, which would just be how you carry oneself, both your demeanor and how you kind of plan your day. Noise, variety, taking food, what food should a patient eat, bed and bedding, light, cleanliness in rooms and walls, personal cleanliness, chattering of hopes and advice. So that's basically false hopes. And then observations of the sick. So basically, this was kind of a precursor to a head-to-toe assessment, if you will. Nurses back in the day, and a lot of notes in nursing is she differentiates between private nurses, which would be informal nurses, like a mother taking care of their child or a sister taking care of the family, and then public nurses, because this is in Britain, so I don't know what they call it over there.
The ward.
No, the National Health Service, is that, what I'm talking about?
I mean, they're like a core too, so I don't know.
Yeah. well, the National Health Service, they had a more formalized health system over there, but that's what she differentiates and what skills all nurses. She regards all people as being able to be a nurse. So I think that's really great. So key principles that stick out to me are all these right here because those are important. And they look at kind of the early fundamentals of holistic nursing. All these will impact your patient, but so let's see. Petty management goes back to that, how you conduct oneself. So it goes back to that presence, that intent, and just that self-care that you go into when you walk into a situation. She goes into and talks about, how you plan your day, and that's important. We always bust out our shift assessment. We write down when we should give a med, when we should, we feel like time guides our day, but really that presence, that being there with the patient, I feel like that's kind of our precursor. Noise, vibrational energy, that's a big one. She talks about, what else does she, kind of goes that biopsychosocial energetic person, that what is out there in the world can impact our well-being, and what happens to us. Food. So she says the patient is the best expert of their health. So what she differentiates is here's what's the food, and she mentioned some things like beef soup, but in taking food, she says the patient will let you know. What you see them eating is much more important than prescriptive diets. One thing I remember her saying is, like British people, they will drink tea. If your patient is drinking like 6 gallons of tea, let him drink that. That is the best guide for them, no matter how good or bad or whatever the tea is. That's what they should be drinking. Again, light, that's that energy, seasonality of things. Chattering of hopes and dreams, that goes back to our emotional self. It's just as important. In fact, your story kind of resonated when you were talking about a lot of the modalities. What first went to my head is, your body has to be ready to take these things, medicine, and sometimes, therapy will work and then it won't. Mm-hmm. And that's what I think of is that this person ready to take this chemo? Are they well enough to take it? And that's mental illness. Health is physical. So that's that trauma that comes in. And then just observations. We as holistic nurses do a lot of observing, but we have a more holistic view. She didn't necessarily say, I think she mentioned a quote like, nurses don't need to look at everything, but they need to be good at certain things. So it kind of brought back to me that holistic nurses look at values, we look at cultures, we look at spirituality, we look at the family dynamics. So we look at all these things before me as a holistic nurse, I don't really care about labs, I don't care about this and another, because I can just ask my patient. Their perception of the labs and their treatment and their diagnosis is just as important than what the chart says. So that's where I kind of first go. And it's much easier because I don't have to scroll through the chart. I'm not that savvy person. So. Why holistic nursing now? I mean, we could just wait. I mean, it costs kind of a lot. Essential oils, and all that massage. That's $60 an hour. I don't make $60 an hour.
I mean,
So it's cost effective. So what are some vulnerable vulnerable populations? Who's vulnerable? Everybody. Okay. That's true. And we are kind of a waxing and waning in our vulnerable. We're an opening and closed system. In terms of that, like if I'm very anxious, I'm open. But if I'm very depressed, I can be very closed off. It's kind of hard, that shell. So that's true. That's a very good point. I'm talking about old people, pregnant people. No, it's true, but I'm talking about research right now.
Yeah.
System thinking, and yeah, exactly. Because when I'm going to a manager and whatnot, or my executive or whatever, I'm saying, how's this gonna work? I can't be like, everyone, I'm helping everyone. I'm helping you, I'm helping, no, they're not gonna hear that. But that's a good point. Holistic nurses thinking about it. So in the US, 75% of healthcare costs is from chronic disease, yet 25 is found in the life. So we're not getting any of that back, we're not, because chronic is gonna last pretty much forever. So 75. So the focus on holistic care is on prevention first and treatment later. Vulnerable populations, more women are using holistic care than men. What do y'all think is causing that? Nurturing, okay.
Men don't really believe in treating themselves.
I joke about that. So I just try to tell you. It's true. It's true.
Well, men have to even be considered to go to the doctor
Yes.
first.
That's true.
But it's more of a stoic. I watched my father, how, he was raised in an era where we have to endure, we have to do this. And him watching me go through my process as far as going through healing work and stuff like that, it has opened up the mental and emotional aspect where he would not have been open before.
Okay.
So what I call falling below the neck, to feel
Okay.
and to hear and to be emotional.
That's
That
true.
matters.
How men are raised.
Yeah.
You just suck it
But that's
up.
just one aspect, raising
The culture.
culture,
Yeah.
especially other nationalities,
I feel like in the South we have many indigenous practices, both from voodoo and the Gullah people to root workers, if anyone knows about that. We have such a rich history, but we're so far from that. All we know, I went to Cartersville the other day, driving through there. I went literally from here to probably the end of the room, and I hit another church, and then probably 500 feet from there, another church on 140, and another church. So that's what we associate spirituality with now. And we don't even think it is everything that drives you. So that's what I feel like is a lot. Men in the South are completely different than you would say men up north, because there's a lot more culture, exchanging ideas. I think that could be a lot of it. So there's greater use in hospitalized patients, not necessarily in the hospital, but once you've had a hospitalization, there's greater use. People who have had chronic pain, those are typically your patients who will say, they've tried everything, they've given me every pill, and there's nothing they can do for me. So they'll seek out holistic modalities. Your patient with hypertension is probably not going to be that patient that's seeking out holistic modalities. They can, but it's something that you have to feel usually. Hypertension is something you don't feel. It's not going to trigger you to go for treatment. Herbal use has increased to 95% in 2002. Should there be anything confounding there?
Legalization of cannabis. I'm talking about
Look, 2002. It could be now. But think about it.
You're talking about the marijuana.
That's why I was like the move.
2000. That's what happened in 2011. 9/11. So just think about that.
Well, no, that's not
9/11, 2001. And so after that, you'll usually see in a lot of the data. Yeah, so in PTSD studies, you'll see a lot of that. So just keep that in. That's another one. 60% do not report cam use to their doctor, mainly because they didn't think it would make a difference or that they weren't asked. So again, that's why holistic nurses are really. So that's why holistic nurses are so important, because we are there usually doing the paperwork, doing the intake. We're at the bedside, so we can make that change. So it's a systems thinking. So 54.9% believe CAM with conventional treatment would help. So like deliver within a framework, Western research and ways of knowing cannot account for all experience of healing. So again, that's going back to that that idea that we should not reduce the patient, that while we want more research on anxiety, depression, all these modalities and how they go back to treating and whatnot, we can sometimes use MRIs and CTs and different bioelectrical machines to look at how these energy fields are impacted. We don't want to reduce the patient because, again, using those technologies puts the patient's ideas away. So I tell people, again, sometimes I love the placebo effect. If the patient thinks they got better from that, then their mind is, again, going to get in that mentality that they are going to be accepting of this treatment. However, I put a little asterisk on it. There needs to be a difference between snake oil and real healing. You can't sell it as it's doing more than what it actually is. So there's variety: herbal supplements, massage, chiropractic, mind-body practices, energy, naturopathy are the most common. So that's a lot. That's a lot of what most people have already tried before they've even kind of gone way out. So anything in that doesn't sound familiar? Wow. Okay. So what does your typical workday look like? What does your typical patient look like?
12 hours.
12 hours, okay. Wow. It's half your day. Frustrated patients, yeah. Why are they frustrated?
Because they're overwhelmed by the health system and the demands that people don't listen to them.
That don't listen. Yeah. That's a lot of my experiences. As soon as I just sit down in my little care chair and stop the break. As soon as I sit down in my care chair and just listen or mostly, just listen, I don't have to say anything. I can just tell the look on their face just melt. They feel diffused. Honestly, they're quite shocked most of the time. That's it. That's it. That's honestly in this system, I feel like the best way to be holistic is that's it. I don't even have to start Reiki somebody. Because they are always cut off. That no one listens. They do more talking than asking questions. So
They don't even understand what's said to them by the doctors or whomever else that comes in the room. So you go in there and say, well, what does that even mean?
Yeah.
And you're like, well, I didn't even hear the conversation.
It's funny. I don't know about you, but in my nursing education, I heard this so many times. It was like a broken record. The health literacy of most people is on the anywhere from 3rd to 5th grade level. Their literacy is on the 8th grade level. I hear so many nurses, doctors, physical therapy, you name it, walking in and say, well, the hypertension and the angiotensin, and they always use the language that I don't.
Right.
Yeah. So you're exactly
And then you get in trouble if you're in there too long.
That's
or a
true.
conversation that should have been had, an appropriate discharge or something, because you're actually trying to be in a care chair and have that moment with them to actually discuss what another provider actually said.
That's true. Or what I find is my other patient gets angry.
Yeah.
You're trying to give
Someone else.
they need because they're different
Yeah.
classes and you have 4 patients.
Or 5.
Oh, I kind of break hip on that one. I tell them, listen, I was with someone else's mother discussing their concerns. What concerns do you have? I'll let them know because they need to. You know what I mean? Everyone needs to feel human because when they hear that, they realize, oh, you know what? I can connect to that because I'm having that concern right now. So you know what I'm saying? It's all about that concern. You know what I mean? So that's my experience. Anyone have anything else to add?
I used to enjoy working at night on the medical side because what I started doing, because I had worked 7 months on day, I would actually ask any questions of the patients if they needed anything. Was there something not explained? Were you curious about something? Just going through a whole thing. So by the time the night was over, there was a list of questions that they would ask to advocate for, just to be more efficient, because that was something that I was seeing because everybody's busy, especially med surg. I had 8 patients one time. That blew me. I was like, you've got to be kidding me. But I was like, what?
I wish I couldn't agree.
I was like, I don't even know.
But you know,
Yeah.
we should be, just remember, we all get busy.
Mm-hmm.
You know, so we should take, I like that trick because we can take ownership instead of saying, that nurse didn't, and they gave me that patient. You know, we can say, you know what, there is actually something I can do. I can answer the question. This 1 minute, I can at least answer what I can. And then when I come back around, then I'm gonna tell them, remember some questions, and I'm gonna come back with some answers.
Correct.
Next time around with you. That's a good one. All right, so traditionally in holistic care, there are 3 errors. So in where we are right now in this hospital, there's still an error 1. Physical causal. So this is symptoms result from some physical cause. So this bacteria led to vomiting, led to nausea, led to diarrhea, led to sepsis, led to low blood pressure. So the mind is on, they usually don't think about the mind, but if you're in mental health, they say the mind is only really the result of the brain. So if you take out one side of the brain, they're going to have some physical, mental, they're not going to be able to emote whatever it is. It's because they had some injury. The stroke patient, when they have, they talk so much, it's because they had that injury from that left or the right side, or they have some, so that's how they reduce people. So they typically look only as far to acupuncture, homeopathy, herbal medicine, or Western medicine, because these are physical. I take a needle and I place it into the patient. There's a physical meridian. It's thought of as physical. There's not an energetic link yet. That's over in the Eastern thought. Error 2, that's mind body. There's a connection that whatever I think is going to affect my body, you'll typically get neurophysiology, where that if I think something negative, that's going to link into an atom that's going to stay in my body, and that you'll hear of interleukins, neuropeptides. That if you think it into being, it's going to happen, but it's going to be on a physical level. That's that hypothalamus, pituitary, adrenal axis with stress. So they're taking Stelli's theories one step further. You'll go to counseling, hypnosis, biofeedback, and imagery, because they're trying to link that mind, all that imaging, that thought, to the physical body, that people with anxiety, they need to relax and calm and get that to come down here to lower that heart rate, to lower that blood pressure, to not remember tension, but to remember a relaxation state. And our 3rd era, sadly, I feel like it's an idealized state. Few get to it, but it's what we're trying to achieve. Mind is not localized, it's infinite, it's unitary in space and time. So this is distant healing, shamanism, and therapeutic touch. So I can be over here and I can send Reiki to somebody anywhere, because this energy is not mine, it's not theirs, it's derived from everyone's spiritual healing. So what do y'all think about it?
I think error 3 is more closer than you realize.
Closer
Like
than
what
we
happened down there with Charlene, that was error 3.
That's error 3. Good.
Because
Okay.
that all happened right in the same moment.
Yeah.
That we all connected that one moment. That nothing, we didn't, but it was all
Just happened.
happened.
Yeah.
Yeah, and I was driving when I got your email, and I had just gotten off the phone with the distance learning college to get my bachelor's, and I was talking to my husband on the phone about, I'm going to do this nursing track, X, Y, and Z, step position, so I had more time to go back to my practice, and your email came through, and I was like,
That's happened. Yeah.
well, look at that.
Yeah. I guess I should clarify. I feel like in the research in nursing, you'll hear Jean Watson is a big error 3 thinker. She will speak. Oh, this is error 3, this is error 3, this is error 3. And then you may ask her, okay, so what do I do in practice? So how do I bring this to my patient? And it's true. I mean, I can sit here and say, I'm going to do distance healing, or I'm going to
Have her answer that. She just graduated from Jane Watson's.
Good. Okay.
So I looked at her last week, and so I asked her that question. I said, they all allowed us to ask her questions, and Jean Watson.
I'm like, oh.
And she's a nursing theorist. She's a living legend. Amazing. And
Way above, beyond her.
Oh, beyond her time. Like, I think she came from a world not behind us, but like ahead of us, back in time to enlighten us.
Anyway, so I asked her, I said, will you give us like guided imagery or meditation about AR3 that we can really in the body understand it? Because like her postmodern nursing book is all about AR3. What is
Her,
AR3?
and then Martha Rogers with the energetic and the body.
Oh my God. So she says, oh, that's a hard one. And I was like, you're going to want me to do whatever you want to do. Like, you want to answer that question? Yes, basically. Like, oh my God. And she goes, okay, everyone silence. And close your eyes. Silence. Close your eyes. Felt it. The entire room. She's like, that is Eric. You're all connected. You're all right here together. And they go all in the same moment. There was no separateness. You're all connected.
Okay, because I saw a talk with her, and everyone kept asking her a question. She goes, just practice the, what's the name of her theory? The transpersonal, the theory? Human caring. She said, just practice human caring. And then she would go on to speaking about herself or her person. So that's true, but come on.
In the body, what it feels like.
Something, yeah, so that's a good one. Okay, I'll remember that one.
Well, as a massage therapist, what we call it holding space for people. So we'll hold space to allow them to experience, feel safe, do whatever they need to without giving, adding in or taking away, and just creating that space that maybe their patients or clients don't normally get from every other experience.
Yeah, so for us, it's, y'all talk about presence or intention.
And interestingly enough, with the research that we've been doing, we had a challenge for some therapists of becoming more protocol based, to not add any variables in to muddy up any of our data. But it's hard to go into a massage without an intention. So we added counting, but even counting can add an intention to it. Yeah, so it's like 1 stroke, 2 strokes, 3 strokes, but you're still, so it's just very interesting how research is looking for data, but also massage is trying to integrate the things that you all are trying to, it's the same thing, like we're just coming together.
Because I'm trying to integrate stuff from y'all. I've gone to so many good ones and they teach me, like, you were just talking about, okay. So, what problems, y'all mentioned some, but y'all actually, what I thought were problems, y'all actually taught me something.
That's that mouthiness.
So what is mouthiness? It's just true. So the problem I see is that, I think we covered it. Area 1 reduces the body. I think this is a pretty good area. The mind and the body is a good connection. And like you said, Area 3, there's that good connectedness. They're always connected. You just gotta know how to connect into it. How much do you want to make create that connection all the time? So I love this. I feel like it's a good solid basis for nurses to connect to, and it really relates to what we already learned. This is the naturopathic therapeutic order. So naturopathic physicians use this. It's 1, 2, 3, 4, 5, 6, 7. So they believe that they should already start here and go and work stepwise. However, you can, if you have a trauma, you can go here. If you have a patient who needs physical alignment, you go here. So it's not a set in stone method. So what you go here is you establish foundations for optimal health. So that's really your determinants. So you remove barriers to health. So say someone is a dialysis patient, yet they can't get to a dialysis clinic because they don't have a bus ticket. You get them to that. That's what I know as a nurse. That's usually what I remember. I went to Augusta. So that would be what I experienced. However, some might be, you get someone's blood pressure down, you get fatty foods out of their way, and to get into a diet. So this is stimulate self-healing, they call it vitality in their system, but basically that's self-healing. You may start meditation and things like that aid the body in that level to help the body. And then you don't even really start to really go into the body. The physician doesn't go in until this level. Supports weakened systems. So they just aid whatever. They go to a whole system. So it would be the adrenal system. It is not the suprarenal glands. They don't go to the urine. They go to the urinary system or the fluid and electrolytes, the circulatory system with that. They don't just go to the little kidneys and do dialysis. So physical alignment, that's good posture. Sometimes they'll do physical manipulation at that level, like the chiropractor would do, massage at that level. But it's really to get the system, the body in line, the cranial synchral system, the mind body to work in sync. Natural symptom relief, so that's herbal remedies. Synthetic, that's your Western medicine, your pills. And then you go to high force intervention, so that's surgery. So that goes through it. Does anyone have any questions about that? So that's, I said, that's something nurses are used to. So does this look familiar?
Maslow's.
Maslow's.
Together.
Nope. Yep. Maslow's. So that's why I like that that model, because it's very physical. It's something that I see in the hospital. We usually go the high end and start there, but it's something that we can start reprogramming. We can start teaching our colleagues that maybe we can go to this patient and say, maybe you should steer away from those fatty foods and go here and affect your diet and support your vitality, and then work our way up instead of our natural instincts to go up here. So, of course, do I need to go through Maslow's? Do y'all go through Maslow's? Okay, good. Okay, so again, up at the top is your growth needs. This is what you need to grow and thrive and be Mother Teresa. And then at the bottom is your deficiencies, so you're a slob. So buzzwords. What have y'all heard about integrative medicine?
The program.
So integrative is taking everything that we already do. This is like what I say for
Go on, I need your elevators.
They're my elevator speech. I say it's looking the person as a whole, mind, body, spirit, and it's taking everything we already do in Western medicine, adding in all the other evidence-based practices in with it. So it's not on its own, but it's literally integrating everything together, starting with self-care. That's integrated health. Integrated medicine doesn't necessarily have self-care.
That's pretty much. Do y'all, what do you know about functional medicine?
Functional medicine goes more of a personalized, lots of tests, does a lot deeper detail. Yeah.
So like you said, integrative, you're combining two or more body systems or specialties, includes mind, body, spirit. So it combines standard of care modalities, drug surgery with non-standard of care, chiropractic, acupuncture. So I say standard of care with non-standard of care because a physician can do it and say, you know what, the protocol says I should give you protonics for this peptic ulcer, but you know what, it sounds like you're having a lot of stress, and we maybe should try this guided imagery. And I say that because we need to, there's ways that we need to incorporate this for our physicians or our colleagues. However, for me, standard of care is guided by what my patient needs and what they're calling for and what they say they need and what they're calling for. Because like Florence said, what the patient's taking and needing, and that's what they need. So, I listen to research and what's going to benefit them. But first, if it's not going to do them any harm, then why not? So, functional medicine, like she said, it's a lot of tests. So they will even go into genetic testing and do gene therapy and find out what's going to work. What's the only downside to that?
It still limits, it limits the person's experience for one, and then it doesn't always incorporate complementary and alternative medicine as far as integrative health goes.
That's true, yeah.
So it's still like super detailed and specific, but it doesn't take everything into accommodation sometimes.
It's error one thinking.
Yeah.
If I'm looking at your genes and how this drug is interacting on this receptor, I'm still looking at you as a physical being. I'm not looking at you as a spiritual entity. Yeah, that's how I look at it. However, care is not based on protocols. It's based on that genetic biochemical profile. However, they make it holistic by saying that a patient has to participate in care and and that's how it's functional, and then finding the root cause of each disease for each patient. So again, I bring up these buzzwords because it's very sometimes hard to break them out. If this will work on this board. No. There we go. Okay, so there's a subjective and an objective experience of health. So on one end, you have illness, experiences of symptoms, which patient describes meaning. And this is all on video, all on Facebook Live.
Are we on Facebook Live?
YouTube Live.
Oh.
Yeah, right there. You might not be if you want to.
Oh.
So it's subjective. So health is an experience of well-being, harmony, unity, and becoming expanded consciousness. So you heard Gene Watson say that, expanded consciousness, and we should, we always go through this continuum. And sometimes we're at one end and the other throughout the day with our patient. Oh God.
YouTube Live.
Come to what?
Can you click?
YouTube. No. Oh, there you go. Okay, so disease is a objective. So I can see it on labs, I can see it on imaging. It's a discrete entity causing symptoms, so it's a deviation from normal. There we go. So the flip side of that is wellness. It's an integrated crew functioning aimed towards reaching the highest potential. So you can see that when your patient gets better, they're running, they're doing it, they're moving, they're doing what they want. So these are kind of what we want. Words, when I read journals or research, you'll see kind of a muddling. I try to use words that make sense to me, a deviation from normal. So integration, very kind of concepts more than anything. Cure versus healing. Can you tell me what you've heard about it, or you know, or maybe I'd say I don't know.
Curative is a finalized process. Healing is it's subjective, but it appeals to a person's well-being and overall understanding of how they want their health and wellness to actually be.
Yeah, that's
As
good.
opposed to curative, it's pretty finite treatment.
That's great. And cure is usually imposed by someone else. Yep, you're very right. So cure is objective, it's linear. So I'm here, or I'm there. Can be. So it's dependent on something. So I'm waiting, and that's physician. Well, whenever he gets here, we can find out if you're getting scoped today, or if you're going to be NPO for 24 hours. So it's dependent, and that's why people they want healing, but they come here for curing, and that's where the disconnect is, and that's where I usually find if you ask them the question, well, what's meaning to you? What's important to you? Or you ask them, what are we all doing this for? And some patients cannot answer that question because it's a very deep question. No one has asked them this hospital stay or their disease process. If they've been here 10 times for a GI bleed and no one has ever asked them, then you're going to have to get to that point. Error one thought is provider driven, like I said. I'm a physician, I'm telling you what to do, or I'm giving you 3 options, you better pick one. If you don't like it, I get paid. Absence of symptoms is the same as curing. If we don't see anything on imaging, we don't have anything. There can be a fear of relapse in the patient. So if they have no symptoms and they have a fear of relapse, there's still something going on there. There's still anxiety, there's still, the family, that fear can maybe spread to the family, or the family energetically feels that, spiritually feels that. There's some of that going on. So unfortunately, death in this process is viewed as failure. You'll hear this a lot. Well, he was a fighter. why is it was? He fought. Or I had a situation where one of my families said something like, well, they weren't fighting. Well, what's that have to do with it? Yeah, I mean, their experience of suffering is not any different, you know. So that's what I have with this. And cure is not always possible, or it's not possible in this time.
Or it's how you look at cure.
It's how you
Cure might be the transition to another realm, if that is what one believes.
Some cultures have that belief
Mm-hmm.
that because this is our finite body, this is our physical body, that you are going into your ancestors. So the Native Americans have that belief that we are really only occupying this physical body, that we are going on to our ancestors. Now they don't hasten their death because they believe it's very fortunate to be in this realm, but it's just going on to a different realm. So they have no real belief or should I say hesitance of death. So that's it. They're not looking for a curing. They are really doing energy therapy. That's again, they're in era 3 shamanism, or they call them medicine men, medicine women. Healing, subjective. It's infinite. It's again era 3. It's unrestricted. I can be here. I can be healing or not healing my body. I can stop and I can start healing on my healing journey, my process. Usually there's a chance to find meaning in every interaction, every test, every treatment, every setback. There's something for it. Like she said, there was, we all came around for some purpose. So that's what healing is always about. And the most important part is it is always possible. Okay. What do you think that means for our patients?
We need to understand the difference of.
Go back. Do you have any questions?
The patients need to understand the difference
Oh.
of the two.
Oh, okay.
And they need to be able to determine, okay, am I here for a cure or am I here for some type of healing?
Yeah.
And they need to be able to determine what type of healing they're looking for.
And what I usually find is, first, it's who am I here for? I've seen this many times. I've literally sat there with a patient, trying to be a healing presence or just listen. That's, important. And this one woman was literally trying to get words out. Her husband kept saying, well, remember, you're just a fighter and God put you on this earth for a reason. And this and that. And she was, she's like, I've made peace. And she was really what I could, since she was trying to get out her words is, I'm not afraid to die. He wanted her to get a new valve and a stent and all this, and he just kept cutting her off. So, and I've seen that with many patients, and I'm in the ICU with many people who are intubated, sedated, so their family members are making words for them, and they are sitting there, please come back to me. And then sometimes they will get extubated and then reintubated, and their family members are speaking with them, I can, over here, and they will be pleading with them, like, please stay. So it's who are they here for? My experience of that one. And that's why I say curing is not always possible. There may not be a drug, there may not be a treatment, they may not be eligible for that treatment because it's dependent. But curing this. That's true. Just remember these overlap. A lot of these concepts are just that. They come out of research. They come out of theorizing. And so each patient, when you're sitting with them, is different. You're not, we're not going to sit here and say, can you please stop curing and just heal with me? Please. Well, I like that healing you're doing. I just try to break it down, especially when you're sitting there going over it and for ourselves. So what does this mean for us?
Also adapting to that same mindset of this is a overall process. It's not just one simple point in time, and everybody evolves differently. So making it completely patient-centered and incorporating what they need for their healing as opposed to putting your preconceived or pre-existing ideas upon their actual healing.
Providing resources, you know, because a lot of people aren't familiar with things, or they may have read stuff or get lost in the rabbit hole of the internet, or maybe have a bad experience with snake oil salesmen, or see on the news that, you know, massages just like undercover car dealers.
Yeah.
And that's one side that our industry combats on a regular basis, and just good information, reliable information, and content, research, and everything.
Read this one. I do Reiki, and so I've heard this one so many times. Oh, I can't do that. I'm Christian. So I say, you know, I go to the hospital. People laugh at me because I'll go out of my way to do anything for a dying patient. I've taken them literally outside the hospital, you know, as they're dying, and my family said, "Oh, that's great because she just loves sitting on her porch." And I'm not, like I said, I can't do that. I'm Christian. So just saying, this is not a faith-based system. Oh my God.
Not only that, we've been doing it for centuries and centuries.
Yeah. And again, you only take what energy you want. So if as I'm doing Reiki, you only want to take the Christian form of Reiki.
Pretty much. No, I love how you
I'm a
put
lady
that.
hands, either way.
Go ahead.
But if you think about it, if you're raised
Check
in
the
a
book of
Christian
Acts.
church,
That's what I tell people.
exactly.
Like, if that's the way you want to go, I'm like, go ahead and read the whole book of Acts.
Exactly the same thing. And it's amazing how religion has divvied up things where if you come from, or what I have learned coming from my spiritual program, where we are really saying the same thing.
Yeah,
It's and how it's been decided, right?
Yeah. I mean, it's crazy. And then I'll say, oh, like I told you, I'm holistic. Oh, I'm holistic. Oh, you do holistic. And I just see sometimes a sense of, oh, that's great, but can you do that really over there?
Yeah.
You know, or some people will have a sense of, I don't know what it means. So again, it's that education. It's a really concept. It's not necessarily that we do certain things. Any other buzzwords or words you're like, I'm not quite certain, or you know, there's a lot actually.
Interestingly enough, I don't know if you all are familiar with this, but the Georgia Board for Massage Therapy no longer accepts energetic practices for massage therapists to renew their licenses. So it has to be, now it's very more clinically based. It has to be physical manipulation of soft tissue on humans. Can't do it on a horse. You know, so there's a lot of people, you know, it's kind of separated the pack of the different practices and stuff like that. So it's really cool to hear that those are some things that you all have chosen to adopt in your journeys.
That's interesting because I've met a lot of massage therapists who want to do Reiki, who want to do healing touch, who want to do, is craniosacral considered physical or is it energetic?
It's energetic.
Energetic. Okay, I do craniosacral and who really are diehard about it.
Yeah, anything talking about the meridians, anything like that, and so it's really kind of separated the schools of thought, just on kind of more of a black and white surface. But now we're starting to see the integrative healthcare coming into and asking massage therapists to become more understanding of like how to integrate it, but also massage therapists too. You know, they might be making $60 an hour. The physical implications of massage can be challenging, just like y'all's schedules can be. And there's only so much money or time to get your renewal for things like that. And so if you can't get CEs for Reiki, then you're going to go for the soft tissue manipulation first. And then maybe when I have time, I can do Reiki. So it's unfortunate that that's something we're dealing with in our field right now.
Yeah, what I encounter is there's what we all know to be true, or what we know to help. We all know this helps, but then there's CMS guidelines over here. So patients are like, I love this. This is what I do. Why isn't it not covered? And I can explain to them, oh, we all know, and your physician would love to give that to you, but this is why.
Yeah, and that's why people see massage more as a luxury unless there's a major health event, or they're in needs where they can't function on a regular basis. And there's an epiphany, there's an epiphany.
So again, I said present. We talked about presence. So it's a multi-dimensional state of being available in a situation with the wholeness of one's individual being, the relationship, style, and quality of being with rather than doing to. So those are that's a lot. So multi-dimensional, available in a situation. So, what are some precursors to being present? I think someone mentioned it earlier.
For everybody?
Yeah, not you said not bringing.
Oh, preconceived or pre-existing.
That's a big one.
Active listening.
Yes.
Active listening.
Being active.
It's hard. It is really hard. Especially, but that's what this is error-free thought, multi-dimensional state. I mean, what?
And practicing mindfulness is
Yes.
totally,
Yes.
it's not easy.
Yeah, you feel like you have to be the Dalai Lama, but no. It really just takes being mindful. Really, that's what it is. It's saying, I'm going to be here with this patient at this moment, or I'm going to be here for myself. If it's just me, I'm going to be here for myself in this moment. I'm not going to be critical. It's really it. So it's your physical body plus your psychological plus your therapeutic spiritual self equals holistic nursing. So you're taking your 5 senses is what they teach you. When you walk in your room, do your environmental assessment, do all that. Do what you're already doing. Your assessment, your communication, your active listening, your empathy. So you're attending to, that's something you're already doing. And then you just gotta add one more thing, you're centering your intention. So intention it's usually taught as this big only. So just start off simple. Say, I'm gonna do good, or I'm gonna be holistically guided to, healing today, or I'm gonna get better at holistic healing today, or I'm gonna be a little bit better today. So again, a lot of those other things: openness, intuitive knowing, communal love, connection. So I love this analogy. This was explained to me. I think I read this in my book when I was studying for my certification. So offering groundedness. So that's what a nurse has to do. They have to ground their patient with self-care first, with knowing who they are first, being confident, and yet confidence. So it's like presence is like being with the patient in that storm. So they are over here in that storm. They're providing a centering influence. So they are also that centerness that they have, they are doing for their patient, bringing them to their center, and then they're offering transcendence, so bringing them out of that storm. It's important because if you are always in that storm with that patient, you're going to get burned out. So that's why you have to kind of know what it's like to be in this storm. You can't just say, wow, that really sucks for you, and just kind of walk out and just go on to your next patient and say, that sucks for you, that sucks for you. But you have to know what it's like to be in this storm and to experience it, and that's what they call empathy. But also be able to come back over here and ground them and pull them out, safely, energetically. You can't solve the world's problems. We have to know when to unplug the energy and plug it to a higher source. So what are some barriers that y'all experienced at present?
The nursing models that we're already taught. Like everything that, not to say I struggle with it, it's just hard sometimes to know everything you've already learned, and then when you get into this realm of outside euphoric NCLEX, what you can actually do and what you're limited by, and then your own personal, like my own spiritual and sensitive barriers often come as an issue.
Yeah, I know it's a system, but mine personally, sometimes I'll get that physician really ticked me off, or why aren't they listening? And I get that frustration. If I ever get that frustration, that it's like when I'm hangry, or if I don't know if anyone here gets hangry. You get hangry and you're just like, and you carry that all throughout the day, and you undump it on someone else, and you just want, oh my God. Well, things aren't going right because this is, and that didn't go right with that patient, so then I'm just going to swallow it back up and then I dump it on you. And you just go like, why am I going through like this? And I even see it in myself sometimes. I'm like, why am I angry? I know I'm angry, but it's hard. It's really hard to sometimes break that negative cycle. So that's sometimes my barrier to presence. And just, saying it's just going to be what it is. Or it should be, this encounter should be what it is. Or this patient should be able to be who they are with me today.
And I would say time to just because you give into this mindset of your task oriented, I have to do this by a certain amount of time, where you can't focus. You can't bring yourself into presence because you're so focused on all these different tasks that you have to handle.
Presence at the bottom instead of how you introduce yourself. Yeah, that's true. So that's just all the resources. All right. I think I'm over time. Sorry. All right. Any questions, comments?
That was great. Thank you so much.
All right. I'm going to send a poll just out to give me feedback for myself as well as what y'all like. Sorry.
How often are meetings?
I plan on monthly, and then we'll see again. Like I said, those meet and greets. I heard a lot of good stories from y'all. So we may get meet and greets, self-care days, or we may alternate meetings.
Cool.
Thank you.
Thank you so much.
All right. Have a nice night.
You too.
What we were supposed to do?
I was going to write a good affirmation to take home. Y'all want just a few minutes and we'll do that? All right. So basically, I was just going to have y'all write a good affirmation. What you can do is you can fold it up. You fold it crossways, make a and then you can fold one corner down to the center.
I folded this the first step.
Oh, sorry. So you fold like this,
Oh, okay.
and then you fold the other way.
I like when they're open.
Yeah.
Yep.
You're showing your age, girl.
Oh, I have an 11-year-old. They still do it.
So then you fold one side down to the center. You fold the opposite corner down.
That's what happened, we get.
So we're doing the fortune cookie time.
Thank you.
No, I'm trying to make a heart. Oh God, it's gonna be hard.